Every 33 seconds, someone in the world dies of heart disease. Yet, many of those lives could have been saved if they had only recognized the warning signs. Not all heart problems come with crushing chest pain. Sometimes the warning signs are quiet, easy to miss, and even easier to ignore. But your body is always talking. The question is, are you listening? Welcome to Medi, your trusted source for reliable, researched medical knowledge. Today we're diving into 7 silent symptoms of heart disease. Signs that are subtle, often overlooked, and deadly if ignored. These symptoms are backed by top medical institutions like the American Heart Association, Mayo Clinic, and Harvard Health. Stay with us till the end. What you learn today might save a life tomorrow. Feel tired now and then. But if you're constantly exhausted, even after resting, and find basic tasks like walking, climbing stairs, or grocery shopping draining, that's a red flag. The American Heart Association notes that this kind of fatigue, especially in women, may signal early-stage heart failure, where the heart struggles to deliver enough oxygen-rich blood to the body. If your socks leave deep marks around your ankles or your shoes suddenly feel tight, don't just brush it off. Swelling in the feet or legs can mean that blood isn't flowing efficiently, a classic sign of congestive heart failure. According to the Cleveland Clinic, poor circulation can cause fluid retention in the lower body as the heart loses pumping strength. Snoring might be the punchline of bedtime jokes, but in many cases, it's no laughing matter. Loud, chronic snoring, especially with pauses in breathing, could point to sleep apnea, which stresses the cardiovascular system. Johns Hopkins Medicine warns that untreated sleep apnea can double the risk of high blood pressure, heart failure, and stroke. Feeling out of breath after climbing a single flight of stairs? Or gasping during mild activity? That's not just about being out of shape. It might be your heart struggling to meet oxygen demands. The Mayo Clinic highlights this symptom as an early indicator of blocked arteries or weakened heart muscles. Heart pain isn't always in the chest. For many, especially women, the warning signs appear in unexpected places like the jaw, neck, shoulders, or upper back. The Centers for Disease Control and Prevention (CDC) confirms that pain in these areas during physical or emotional stress may signal an oncoming heart attack. If you suddenly break out in a cold sweat, feel lightheaded, or even faint, don't just chalk it up to dehydration. These symptoms can mean your heart is not supplying enough blood to your brain. According to the National Heart, Lung, and Blood Institute, these are classic symptoms of an active heart attack, even without chest pain. A fluttering, racing, or skipping heartbeat could indicate arrhythmia, an abnormal heart rhythm. One of the most dangerous forms is atrial fibrillation, which increases your risk of stroke by 5 times. Harvard Health Publishing warns that ignoring these signs could lead to serious complications or sudden cardiac arrest. Heart disease is called the silent killer for a reason. These symptoms might not scream, but they whisper with urgency, and ignoring them can cost you your life. If any of these symptoms sound familiar, don't wait. Talk to your doctor. Get screened. Be proactive. If this video helped you become more aware, help us spread this life-saving knowledge. Hit that like button. Share it with someone who might need it. And subscribe to MediWise for more science-backed, health-focused content. Because when it comes to your health, ignorance isn't bliss, it's risk.